Good afternoon, everyone. Today, Dr. Ezike and I want to provide another update on both our vaccination progress and the ongoing mitigation efforts across the state of Illinois. First, on vaccines. As of last night, approximately 587,900 total doses of the Pfizer and Moderna vaccines have been delivered to the state of Illinois. 478,175 doses to public and private healthcare providers outside of Chicago, and 109,725 doses to providers in the city of Chicago. As you know, the vaccination program for long-term care facilities is a federally operated pharmacy partnership program with CVS and Walgreens, the doses for which are removed from our state's allocation before we receive the deliveries that I mentioned above. To date, the pharmacy partnership has acquired about 231,400 total doses to vaccinate staff and residents of these facilities, starting with skilled nursing homes. That breaks down to about 172,500 outside of Chicago and 58,900 in Chicago. Illinois as a whole, including the city of Chicago and including the Pharmacy Partnership Program, has administered approximately 334,939 vaccine doses as of last night, 36,867 by the local pharmacy partnership, and 298,072 under the control of the state's public and private healthcare providers. Starting tomorrow, Illinois' latest vaccine numbers will be found on the IDPH website and will be updated daily. While Illinois reports out to the CDC like all states do, their posting of the latest information about doses administered can be delayed. So our IDPH website will be the most up-to-date source of information about our vaccine distribution and administration on a daily basis. As a reminder to all of you, according to CDC guidelines, healthcare providers are allowed to report vaccinations up to 72 hours after they have been administered. So there's a significant time lag between vaccinations being actually administered and those that have been reported. In addition, vaccine doses that are distributed to Illinois are reported immediately by the CDC, so there's a mismatch on both the CDC and the IDPH website between vaccine doses distributed and vaccine doses administered. This is the case all across the country. To put this more simply, a vaccine dose that arrives in Illinois may be administered on day 1, but may not be reported until day 2, day 3, or day 4. Those are federal rules. To be clear, statewide, we have made significant progress in Phase 1A, and I appreciate the hard work of healthcare providers across the state to move as quickly as possible through this phase. In some communities, they've been able to substantially complete Phase 1A. IDPH is allowing any local health department in that position to move into the early stages of Phase 1B because we want to make sure any available vaccine is administered quickly to the priority groups that we've laid out. Local health departments will communicate this information to the public as they move through their Phase 1A population. But I want to urge patience. Phase 1B will take many weeks to complete, and if it's not yet available in your area now, it's because many counties aren't through their 1A population enough to move forward with the current pace of national vaccine development pipeline. I expect to make a formal announcement later this week on when Illinois will move into Phase 1B on a statewide basis. Of course, anyone in Phase 1A who has chosen not to get vaccinated will nevertheless be able to opt in during any subsequent round. This is about leaving no vaccine sitting on the shelves as we move forward. So now I'd like to talk about mitigations. In other words, what we can do to keep everyone safe while we're waiting for enough vaccine to be produced. Tier 3 mitigations have been in effect across the entire state since November 20th. And that has been an important factor in keeping hospital beds and ICU beds available at Illinois' hospital systems through this year's holiday season. This fall and winter have brought the United States to new all-time records in hospitalizations and in deaths, and Illinois has not been immune from that. But in large part because we acted before Thanksgiving with Tier 3 mitigations, we in Illinois have seen the number of COVID hospital patients and our positivity rates drop by over a third since November 20th, as hospitalization rates across the nation have continued to surge. That said, our success is relative and it's precious. We still have more than twice as many COVID patients in the hospital statewide than we did in the summer, and we've seen recent fluctuation in our case rates and test positivity that has stalled that downward trajectory. By operating with consistent and meaningful mitigations throughout the holiday season, it's my belief that Illinois has saved lives, brought down community risk, and set ourselves up to reduce these mitigations in a way that is both safe and smart. All that said, ahead of the 15th, when regions can begin to move to Tier 2 or Tier 1 according to their metrics, I want to provide a brief reminder as to what these changes actually entail. This information, of course, can also be found online on the IDPH website at dph.illinois.gov/COVID-19. Since late November, all regions have been in Tier 3 mitigations, the most stringent of the surge mitigations, in response to exponential growth in COVID-19 infections statewide. I want to be clear that just as regions moved into mitigations with a data-driven approach, beginning again on January 15th, they can move to lower tiers of mitigations. And I'll remind you about the 3 metrics that a region needs to meet in order to loosen up to Tier 2 mitigations, although you can find metrics for each tier on the website that I mentioned earlier. Number 1, a test positivity rate below 12% for 3 consecutive days as measured by the 7-day rolling average to account for any hiccups in the data. And 2, greater than 20% available staffed ICU and general hospital beds for 3 consecutive days on a 3-day rolling average. And 3, a decline in the number of people in the hospital battling COVID-19 for 7 out of 10 days, also on a 7-day average. Remember that these metrics together give us a picture of community transmission risk and hospital availability to treat any influx of patients, which could include those in need of care because of COVID-19 or anything from car crashes to heart attacks to critical surgeries. If things continue to improve in a region, IDPH will reclassify that region according to Tier 2, Tier 1, and back to Phase 4 as they meet the necessary metrics. If we maintain adherence to mask wearing and social distancing and make sure to get vaccinated when it's your time, we will experience a robust recovery that I know we all look forward to. And with that, I'd like to turn it over to our Director of the Department of Public Health, Dr. Ngozi Ezike. Doctor?
Good afternoon, everyone, and I think it's still appropriate to say Happy New Year. I'm happy to be joining you here in Springfield. It was here in Springfield almost exactly a year ago when we announced the first COVID-19 case here in Illinois, and it's been a long, challenging year, but the end is in sight. Today, 4,776 new individuals were diagnosed with COVID-19 for a total of 1,033,526 cases in Illinois. Since yesterday, we have received reports of 53 individuals who have lost their battle with COVID, and that brings our total of lives lost in Illinois to 17,627. 3,540 individuals were in the hospital overnight with COVID-19, and of those, 759 were in the intensive care unit, and 401 were on ventilators. In the last 24 hours, more than 66,000 COVID-19 test results have been reported for a total of more than 14 million tests statewide. We know that moving out of the mitigation tiers will require us to continue to wear our masks, to continue to keep our distance, and to continue to avoid large gatherings. And now we can add vaccination to the list of things we should do. While the number of vaccine doses that providers in Illinois receive each week remains quite limited, it is important for those who are eligible to receive the vaccine to avail themselves of all the information and hopefully decide to get vaccinated. Vaccination is essential to us moving forward, but it only works if we actually utilize this critical resource. I understand that people are hesitant about getting this new vaccine. They are concerned that it was developed quicker than ones we have seen in the past. However, I want to assure you that every step that is required for vaccine authorization was followed for the current COVID vaccine. The vaccines did go through rigorous clinical trials in which thousands of individuals were vaccinated and followed. No step in that process was skipped. The advancements we've made in science and technology have allowed us to reach this point, and we have safe and effective vaccines. As the vaccine becomes more widely available and the number of people who are eligible expands, I want to encourage people to share their vaccination experience by posting photos of them getting their shot and use the hashtag VaxUpIllinois. That's hashtag VaxUpIL. The more people see others getting vaccinated with the safe and effective vaccines, we hope that more people will roll up their sleeves and do the same. Again, don't forget, we want you to share that photo at hashtag VaxUpIL. So the 4 steps to beating this pandemic are still wash up, back up, 6 feet of distance, mask up, and now vax up. Thank you. Buenas tardes. Hace casi un año que estuvimos aquí en Springfield cuando anunciamos el primer caso de COVID-19 en Illinois. Ha sido un año largo y difícil, pero el final está cerca y a la vista. Hoy se reporta 4,776 personas nuevas con COVID-19, para un total de más de 1,033,000 casos en Illinois. Desde ayer hemos recibido informes de 53 personas con COVID-19 que han muerto, por un total de más de 17,600 vidas perdidas aquí en Illinois. 3,540 personas estuvieron en el hospital desde anoche con COVID-19. De ellos, 759 pacientes estaban en la unidad de cuidados intensivos y 401 pacientes estaban en ventiladores. En las últimas 24 horas, más de 66,000 pruebas de COVID-19 fueron hechas para un total de más de 14.1 millones de pruebas en Illinois. Sabemos que regresar a través de los niveles de mitigación requerirá que sigamos usando nuestras máscaras, mantener la distancia y evitemos grandes reuniones. Pero ahora podemos agregar ponerse la vacunación también. Si bien la cantidad de dosis de vacuna que reciben los proveedores en Illinois cada semana sigue siendo limitada, es importante que la gente que son elegibles para recibir la vacuna se vacunen. La vacunación es esencial para avanzar, pero solo funciona si las personas se vacunan. Tengo entendido que gente tiene dudas en recibir una nueva vacuna, especialmente una que se desarrolló más rápido que los que hemos visto en el pasado. Sin embargo, se siguieron todos los pasos para la autorización de la vacuna COVID-19. Las vacunas pasaron por rigurosos ensayos clínicos en los que se vacunaron miles de personas. No se falta ningún paso del proceso. Los avances que hemos logrado en ciencia y tecnología nos han permitido llegar a este punto y tener vacunas seguras y efectivas. A medida que la vacuna sea más disponible y la cantidad de personas que son elegibles se expande, quiero alentar a las personas a compartir su experiencia de vacunación. Sube sus fotos o videos en Twitter, Facebook o Instagram usando el hashtag VaxUpIL. Mientras más personas vean que otros se vacunan con una vacuna segura y eficaz, esperamos que más personas se confían. Los 4 pasos para vencer esta pandemia son lavarse las manos, mantener su distancia, usa una máscara y ahora Vax Up con la vacuna de COVID-19. Muchísimas gracias para su apoyo. And with that, I will turn it back over to Governor Pritzker.
Before I take questions today, I know that many of you will want to get my reaction to the news today out of the Illinois House. As I have said many times, I will work with whoever the members of the House of Representatives elect as their speaker. Choosing the speaker is the sole responsibility of those representatives, and it is clear that the members are taking their choices seriously. And with that, sorry, Shia had her hand up first. Yeah, go ahead, Shia. I promise, but she's not been in the, you've been on the online too. Yeah. Well, you know, it's the responsibility of the governor to work with the leaders, both parties, and their caucuses. And so the last time I spoke with the speaker was a couple of days ago about the decoupling bill. So that's the last conversation that we had. But I'll work with whoever gets elected as speaker, and again, as I have with the minority leader in the House and the Senate president and the minority leader in the Senate. Did I ask him to step down? No, I was in a conversation about getting things done. He is still the speaker now. We're trying to get decoupling done during this lame duck, and as I've said, the members of the House of Representatives are going to be voting on who their speaker is going to be.
On the decoupling bill, why you said that in your budget that you gave tax incentives to big data centers, companies lucrative like Facebook, is good for jobs. You've made that case.
Yep.
Why is it bad for companies now to take those tax rates and put it in the economy?
Well, let's start with certain are better than others. Certain of these incentives are better than others. That's one thing to take account of. The second is that, you know, the Republicans are want to have it both ways, right? They want to, you know, claim that, you know, they want to demand cuts in state government, but they don't want to accept any that might affect constituencies that support them and write them checks. And so I would just say we've got to look at the entire state budget. We've got to look at expenditures for businesses, and we've got to look at expenditures for individuals. These are going to be painful cuts that get made. I am willing to talk to anybody about any of these cuts and have heard nothing from the Republicans about their ideas. But let's be clear, when they're fighting against some cut that I'm putting out there, what is their alternative? They have literally not put anything forward.
Do you want to see the calculated income tax back on the ballot in 2022?
Do I want to see what back on the ballot? Is that your question? That's not something I'm pushing for. Right now, that we've got to balance the budgets that are ahead of us. That's not something that can happen as a result of that. sorry, this gentleman here.
Today, the Senate passed a bill that will allow the Chicago Teachers Union to collectively bargain that bill now heads to your desk. What are your feelings on the bill, and when it gets to your desk, will that be something that you look at?
Well, I have favored passage of that bill since I was a candidate, since really before I was a candidate. And so, you know, that bill I know is coming to my desk, and I'll obviously take a serious look at it, but you know where I've stood for several years already. Bruce.
Members of the media here, back to the COVID, are we going to be in 1B because some of us have to go out and cover demonstrations we'd rather not be at, some of us end up in rooms closer to each other than maybe we want to be. Where are we in? Where are we?
There may be other reasons for that, Bruce. Yeah.
Where are we?
Yeah. Well, you know, we've put out what our prioritization is for 1B. I'm sorry?
Are we ahead of inmates?
Well, as you've seen, we've got 3.2 million people in Phase 1B. What I have been very focused on is two things. One is lowering the age, because as you know, the people who have died most often from COVID-19 are those who are older. And so the age bracket that I put forward, 65 and over, covers a great deal of those. The second feature of the changes that I made is really a focus on equity. Because we know that black and brown communities have been ill-affected by COVID in a way that others have not. And so by lowering the age itself, not to mention the categories of people who are covered, we are in fact effectuating equity. This gentleman back here.
The Black Caucus's legislation, especially criminal justice reform, there are a lot of controversial parts of it, and you voiced successors support for some of it. So what's your view overall of that package, and what's your likelihood of signing?
Well, we'll have to take a look at the final version of it. As you know, I have advocated and worked with the Black Caucus on many of the provisions. You know, for a long time, even before there were these 4 pillars that the Black Caucus put forward in their agenda, and then as that began to take shape, we've been talking to individual members of the Black Caucus to make sure that we're helping them shape and, you know, and coming up with ideas that I can favor in the process. But I am very much in favor of the process and the work that the Black Caucus has done overall. Sorry, there's somebody behind you who hasn't asked a question.
Is there anything you're working to change in the Black Caucus with any of the lawmakers? Is there any language you want to delete in their criminal justice or any other bills?
There have been a lot of discussions about that, and again, I don't want to go into, as you know, those bills are quite extensive, and so I'm not going to go down every issue with you, but you know that I have favored ending cash bail, for example. That's something that I've worked with Senator Peters on, and that's just one example. There are quite a number of others. I favor the work that the Attorney General is doing on police reform. So, you know, we're all working together, I think, to get good results here. I'll come to you.
There's an FBI bulletin that armed protests were planned at all 50 state capitals, and then on January 16th, we talked about what security measures they're going to put in place here. And also, as House Democrats try to figure out who their speaker will be, would you be okay if this process dragged out for days or weeks, or is it absolutely essential that there's a speaker elected on Wednesday?
Look, we've got a lot of work that we need to get done. So you know, as to a Wednesday deadline, I'm not going to speak to that. I'm just going to speak to the fact that the General Assembly has not met for quite some time. There are quite a number of bills that need to be worked on and passed. You know, we're here in lame duck. As you've seen, there's a plethora of legislation that is moving through, some of it at light speed, some of it slowly. But you know, I'm looking forward to working with the leaders, whoever they may be. You asked about security measures, and I know I'm not going to talk about the specific security measures, but suffice to say that the ISP is quite well aware of the challenges that may crop up. They've seen them even leading into the session days here. And they will work. You know, we have a great security team for the state consisting of all 3 agency heads. That's General Neely at our National Guard, Director Kelly at the State Police, and General Tate Nadeau at our Emergency Management Agency. And we really work very cohesively, and they've done a terrific job so far. Sorry, Hannah. Yeah.
Did you ask for Linda Chapelia's resignation from the Department of Veterans Affairs today? Did you, or in the past week, have you heard anything new recently that changed, your mind from when you hired the administrator level to now?
Look, what we want to do is restore confidence that people have in our Veterans Affairs Department, and we want to do our best to take care of our veterans. As you know, Linda Chapelivia served for a number of years in the legislature. She's somebody who cares deeply about veterans. Her appointment, as all the appointments of my cabinet, come up in about a week for reappointment or not. And it was a mutual decision that she would step down.
2 more questions, and then we have to move on to the WebEx. 2 more questions, and then WebEx.
Vaccines are available, when we're going to be in phase 5, and then you could address the police negotiations with collective bargaining issues, apparently they want to limit that, and the criminal justice police reform bill to address those issues in phase 5 and the police.
So you've asked this question before, Greg, and it's the same answer that I've given before, which is that, as you know, what we have talked about in moving to phase 5 is that vaccines are widely available, and our intention in putting that out was to make sure that actually people are being vaccinated. Right now, as you know, we're not receiving enough vaccine for the state of Illinois. We don't even have 1 million doses, and there are 12.7 million people in the state of Illinois. So the question is, when are we going to get to the point where we have enough vaccine and have administered that vaccine, and to make sure that we're getting herd immunity, or at least, we're in that direction.
Is there a specific phase, though, like 1C or 2 or whatever it may be that you
It's, you can look at the numbers of people. The first phase has about 850,000 people. That was phase 1A. 850,000 people. Not everybody decided to take the vaccine, but many did. Phase 1B, which I just said, was 3.2 million people roughly in that phase. And so you can do your own math to determine, when we'll hit kind of a number where people can really be safe. I do want to remind everybody that even if you've been vaccinated, you should continue to wear your mask. And because the studies really aren't complete yet on whether or not somebody who's been vaccinated can carry the virus on their clothes or something else and convey it to somebody else. And I'll let Dr. Ezike give you some of the details from a medical perspective. But we just all need to be very careful and patient over the next several months.
One more question, one last question.
I apologize.
Police unions and sheriffs have warned mass resignations could happen in police forces and law enforcement across the state if you end qualified immunity and expose officers to more potential liability. Can you evaluate that warning?
Look, I can't. What I can tell you is that there's a lot of work being done in the legislature on this issue. We'll see where it comes out and whether it lands on my desk. But suffice to say, we obviously want to attract more people to keep good police officers on duty. I am committed to important aspects of police reform. I've always been that. You've heard me say this a number of times. I heard it. I talked about it on the campaign trail. I talked about it all summer as we were, protesting the murder of George Floyd and Breonna Taylor. I'm going to continue to favor much of the work that's been done out of the Black Caucus.
We have to move online. We're moving online. We have a question from Jim Haggerty, and this is for Dr. Ezike. Dr. Ezike, the number of test labs being processed has appeared slightly lower in the past couple of weeks. Is that because fewer people are being tested, or is there a backlog in reporting?
Thank you for that question. So I think with many holidays, we have seen some dips. There are some pretty characteristic patterns where a lot of people might get tested before the holiday. Maybe they're planning to do this as part of a quarantine and then a final test before they before they meet with family members. And then, we've had an extended holiday period of the 2 weeks. So we did see the numbers start to pick up at the end of last week. I think we had a day with 100,000. The weekend was low again, so we're continuing to follow the trends and see what's happening. I don't think, I have not been made aware of a backlog. If that is the case, of course, we will let you know that, and then there will be a resultant bulge. But I have not been informed of that. We're continuing to see if this is more coming out of the holiday period.
And we have another question for you as well. This is from WBZ. Many healthcare workers are hesitant to get the vaccine, and hospitals are eager to start vaccinating some patients to slow the spread of the virus. How long will you wait for more healthcare workers to get vaccinated for COVID-19 before moving on to the 1B priority group, the elderly and certain essential workers?
Right. So the governor will announce when the 1B transition date, and that will not mean that people who are not vaccinated in 1A, who are eligible under 1A, cannot get their vaccination. We know that not everyone in 1A will be vaccinated, so some of the people who have yet to be vaccinated, some may be due to hesitancy, and some may be that they haven't had an opportunity yet. So we are continuing to work on education. What I do want to stress is that, though the vaccine is here, we also know that the UK variant, if it's not here yet, it's only a matter of time that it is. It's likely already in the state, but it's probably circulating in such low numbers right now that we have not identified it. The significance of us knowing that it's going to be here, is already here, is that with time, as it did in the UK, it will predominate and be the dominant strain, and that would only take a few months. So potentially in March we could have this new variant be the majority of our cases, and that means that we will have more infectious spread. So the mitigations that we are doing now or not doing will result in potentially more cases, which inevitably means more hospitalizations. So it is very important that we get as many people vaccinated. The beauty of being here at this point, knowing this information about the UK variant, unlike what the UK had, they did not know that this was brewing. We know that this is brewing, and therefore we have the opportunity to use that information and make better choices around the mitigation, around avoiding gatherings, so that we can get as many people vaccinated, stay safe, before this variant inevitably takes over and causes what it wants to cause, which is more cases, and eventually that means more deaths. So I'm hoping that we will all be friendly with our masks as we wait to get vaccinated. We know that we're waiting for additional supplies. We're hoping that we'll see many, many more, and maybe even additional vaccines that will help this process go faster. Therapeutics. So remdesivir is still out there. There's the monoclonal antibody that's out there. I think some of the reservation is that they are, in some cases they may be helpful, in some cases not. I think if you look at the World Health Organization, they are not giving it a veritable thumbs up. In terms of the monoclonal antibody, looking at the most recent research, the NIH is saying that they can't for sure say if it's a substantial benefit, and so I know that's why some people might have pause and not using it as much. But these are things that we have that can be maybe helpful in some cases, maybe appropriately selected. But we do have the vaccine, and we do have our mask, and we know that those work, and I'm hoping that people will continue to avail themselves of the mask for sure now, and the vaccine when it's their turn.
Dr., we have the post-holiday surge, and when is the state going to be able to increase the pace of vaccinations? Because at this point, it's going to take several years to reach the whole.
No, as the governor mentioned, there were only 850,000 people in this initial swath of the population, but as he said, in 1B there are 3.2 million people, and I think everyone knows within that swath there are lots of eager individuals that want to get the vaccination. So when we make that pivot to that, I think the product will be flying off the shelf, if you will. And so we're looking forward to that, to get larger numbers of people vaccinated every day and get us closer to the end of this pandemic.
We have to return to the WebEx.
I'm sorry, excuse me 1 second. I do want to make sure and give you just an additional part of that answer, if I may, which is if you look at the my remarks earlier, I actually was addressing precisely that, what you're getting is lagging data about vaccines administered, but you're getting timely data about vaccines distributed because those get announced immediately, and the administration of those vaccines have 3 days, 72 hours after they're administered to be reported. So it's a little, there's a mismatch and a time lag. We're actually at a pretty good pace administering. And then I think relative to a question that came in that's in the same vein, hospitals whose tally of vaccines that they said they would need sometimes found that fewer people got vaccinated or chose to get vaccinated than they would have wanted. And so they have excess vaccine that gets left over from that experience. And what we've said, because we don't want any vaccine sitting on a shelf anywhere, what we've said to the local health departments where those hospitals reside is, let's get those out to 1B, people who are in this next phase, even though we haven't moved everybody into the next phase. We don't want any of these vaccines sitting around. If healthcare workers in that location are not taking up that vaccine, then let's give it to people who are next in line.
Are you confident we can get the whole state vaccinated or offer everybody by the end of the year?
I am confident that everybody that wants to be vaccinated will be able to by the end of the year. I will also say that I've been on the phone constantly with federal officials, both in the administration, the current administration, the future administration, as well as with our senators about what more we will need from the federal government in order to speed up the pace, because we all want this to happen faster than it otherwise would, but we need more vaccines delivered. That's really the number one thing we need. Then we would like very much to have either the Army activated or the HHS, has its own staff that are available to activate to send to states. We would love to get more people involved in administering vaccines and be able to set up locations. And we're doing that with our National Guard, but more is better.
We have to return to the WebEx. Excuse me,
sorry,
everyone.
yeah.
We have to return to the questions online.
I apologize, I'll come back.
So Amy Jacobson asked this question. A lot of our friends' parents have already been vaccinated in Florida. They live on their own, not in nursing homes, and waited in line in their cars. Why aren't we doing this here in Illinois?
Well, they're depriving seniors of vaccines when people who don't belong in the category that's been approved are allowed to get vaccines. I just read a story about foreign nationals who are flying to Florida to get vaccinated ahead of people who are authorized to be vaccinated. That's improper.
We have a question from Ryan Boyles from Health News Illinois. What are your thoughts on President-elect Joe Biden's recent comments to release nearly every available dose of the COVID-19 vaccine when he takes office? What would this mean for Illinois?
Well, as you know, I wrote a letter with 8 other governors to the Vice President-elect to encourage him to do just that. And he has agreed that he will. That means that we'll get more vaccine earlier. They obviously are going to take care to make sure that we have second doses available at the right times. We've been delivering second doses, 3 weeks for one of the vaccines. You've got to wait for the second dose 3 weeks, and 4 weeks for another vaccine. That's something that we're all keeping track of, and the federal government, no doubt, will hold some back, but they've been holding back enormous stores of vaccines, and we should be getting that out to people as fast as possible, especially because we're hitting record numbers of hospitalizations and cases and deaths in the United States.
This is from Kelly Bauer, Block Club. Illinois' peak came in mid-November, and things started to go down before the Tier 3 mitigations. Why do we think we hit a peak before the mitigations? And since mitigations went into effect after the peak, why do we think they played a role in decreasing spread?
Well, you may recall that we had mitigations in place before the Tier 3 mitigations were announced. We already had Tier 1 and Tier 2 mitigations that had been imposed on every region of the state of Illinois, and then we saw a continuing surge happening all across the United States and, of course, in Illinois, so we went to a Tier 3 across the entire state. And look, that's helped to mitigate. Remember what happened in between the peak that she's talking about, and today, we had Thanksgiving, which I think everybody in the country knew was going to create some kind of a surge. So you needed to offset the surge as best you could, as early as you could. And then, of course, very shortly after came Christmas and New Year's Eve. And that's why, we're now in a position that we're in. Things are going in the right direction. January 15th, we'll be able to move regions from Tier 3 to whatever tier they're qualified for at that point.
And this will be our last question. This is from Dan Kramer. We discovered that IDES was mailing out full Social Security numbers to random strangers as a result of scammers. IDES pledged to stop mailing out full socials, period. Why don't all state agencies, including the Revenue Department, promise to do the same?
Well, I appreciate your raising the issue about all the other agencies. All I can say is that IDES, working together with the Attorney General's office, with the federal government and FBI, are attempting to deal with these scammers who've come in with hacked data, not hacked from the state of Illinois, but hacked from other sources, and then using that data in order to falsely claim unemployment. This is a federal problem. It's a federal issue. We are on the front lines trying to help deal with that. It's costly to the federal government if it goes through, but we've been able to mitigate or deal with it relatively well in the state of Illinois so that people are not experiencing losses.
All right, thank you, everyone. Thank you, everyone.
Thank you.
Thank you.